Hello, my name's Carolyn and I'm an upper GI and hepatobiliary nurse specialist based at South Tyneside and Sunderland NHS Foundation Trust. What that means is I look after anybody with any confirmed or suspected cancers of your esophagus, your stomach, your liver, your gallbladder or your pancreas or bile ducts. You will be referred to either myself or one of my colleagues upon suspicion or confirmed diagnosis of cancer, and at that point we will become your key worker. Part of the specialist nurse's role is to ensure that communication between all the members of the multidisciplinary team that are supporting you in your cancer journey. For example, the gastroenterologists, the surgeons, the oncologists, the oncology unit, as well as a number of other areas such as social care in the community, district nursing teams and GP practices. When you are given a suspected or confirmed diagnosis of cancer, you will undergo several tests and investigations. These will be discussed at a specialist meeting by a number of healthcare professionals to come up with a management plan which is unique to your individual circumstances. Part of your key worker's role is to ensure that this information is fed back to you in a timely manner and a way in which you understand. When you meet your specialist nurse, they will spend time with you to assess your individual circumstances. It may be that they need to coordinate ongoing referrals such as to the dietitian, to the Macmillan team, to the community support teams. It may be that they're involved in supporting and communicating your news to your family members and loved ones. The information that is given to you should be backed up with written information. If this is not given to you at the time, then the areas where you can access this information are also on our website. Receiving a cancer diagnosis is very difficult. As well as having clinical symptoms, it may be that you have concerns in other areas. Your specialist nurse is here to support you with the emotional and psychological aspects of a cancer diagnosis, as well as helping support you with regard to your friends and your families. You may be a carer, or you may be cared for by somebody else. Your cancer nurse is there to support you and your loved ones. In addition to meeting your cancer nurse specialist who will support you throughout your cancer journey, you will also be given contact details for other support networks. For example, our Macmillan Centre, which are based on both hospital sites. Although your cancer may be diagnosed at South Tyneside and Sunderland Foundation Trust, there is a chance that your case will be discussed with one of our tertiary centres who specialise in the management of these cancers. Either at the Freeman, if you have a cancer of the liver, the pancreas, the gallbladder or bile ducts, or the RVI if you have a cancer of the esophagus, the stomach or first part of your bowel. As part of your staging for your cancer diagnosis, you may have to undergo some tests and investigations at a different hospital site, or you may need to go to the RVI for an endoscopic ultrasound scan. Sometimes the outcome of these discussions are that recommended interventions should take place, such as the need for a stent, for example. That does not always need to be done at a specialist centre and can be done locally, and your cancer nurse specialist will make sure that you get the information and the rationale behind any decisions made. It is important to remember that every cancer journey is individual. Try not to compare yourself to somebody else you know who has had the same or a similar diagnosis. I am just one of a team of cancer nurse specialists for upper GI and hepatobiliary cancers based across South Tyneside and Sunderland. We are there to support you throughout your cancer journey. Your responsibility is just to keep in touch as and when you need us. Thank you.